All right, hello everybody. We are going to talk today about labs, like your annual labs that you might get run at a doctor's office. I want to talk through just sort of maybe what labs to get and what just a little bit high level, what they mean. We're not here to diagnose anybody today or provide any specific medical advice, but just to look maybe in a different way, looking at your labs. My name is Sarah Hotchkiss. I own Catalyst Wellness Coaching downtown, and I work with adults and some teenagers, primarily around autoimmune disease, GI disease, and just overall health, a lot of weight loss also. I'd say the number one symptom that people come to me with is usually fatigue, and that crosses that crosses the lines of kind of lots of different disease states, I would say. Um, and so that's the main thing that I kind of work with people. Everybody on has a handout, so you can kind of look through everything, but I'm just going to walk through kind of high level today. One of the biggest things that I hear a lot of times is people will say, your labs are normal, you're fine, everything's fine. But you think, man, I don't feel fine. I've put on all this weight around my midsection. My skin doesn't look right. My hair's falling out. I'm really tired. I'm bloated. I'm not sleeping well, things like that. And so it's very almost invalidating sometimes to hear that your labs are normal and you feel like crap. And so that's what I'm here to kind of dig into a little bit today. So, or sometimes you'll hear your cholesterol's high. We sent a prescription to the pharmacy, and then that's it. Or your labs look fine, but your BMI is high. Like you should lose some weight. So just eat healthy. But there's no discussion of what eat healthy means either. And if you've been around long enough, there's many interpretations of eat healthy, like a million. So that's why I'm here for sure as well. And so maybe also you've asked your doctor or medical practitioner to run certain labs because maybe you're concerned about type 2 diabetes or something like that, but your insurance won't cover running those labs because the rest of your labs are good or you're of normal weight or maybe you don't have a specific family history or something like that. And so that sometimes is frustrating also. Um, and so I'm trained in functional blood chemistry, and so I tend to look at your labs and your blood panels a little bit differently than maybe your traditional sort of Western medicine doctor. But I'm going to look at them from a narrower perspective, and so vitamin D is one that I talk about often. But instead of looking at the range here, I'm going to look at it here because I am looking at precursors of disease. So I am looking at things that maybe are causing symptoms and the reason that you don't feel great, but it's not technically, it's subclinical, we would call it, and it's not technically in a disease state yet, but it's kind of one of those things that makes you feel not great, like low vitamin D. And so I'm looking at preventative and trying to get things where they need to be before they become an issue, before you have diabetes. Before you need high blood pressure medication, although I would argue that we can fix most high blood pressure stuff with food, but things like that. So that's the idea, is to just kind of look at these things a little bit differently. So, like I said, a lot of times insurance won't cover what you want. And I'm going to go through my suggestions of what labs to get. Um, each year you may or may not be able to get some of these covered. Of course, we do these at the doctor's office on the south side, cash pay clinic, right off of 51. So if you need some of these, we can run any of those also. Or if you want to get some done at your traditional medical facility and some with us, that's cool too. And so there's tons of other labs that may be unanswered here today that I am not going to cover because we'd be here for 3 hours, but I want to give you just kind of a run through on some of the basics. So the first point I want to talk about is something called reference intervals. And so that's that range that I was talking with you about. And so reference intervals, they'll give you a number. And I'm going to use vitamin D as an example again. So vitamin D, the reference interval is usually 30 to 100. And they'll say if you're over, if you're under 30, that's low. And if you're over 100, that's too much. And so that's not the reference interval that I use for vitamin D. I usually use 70 to 100, and I don't have a super big concern if you're over 100. But a reference interval reflects the range of results in 95% of the population. So while there's an effort made to generally remove the data of those with known illnesses in those, let's say, 10,000 people that were used to test and get that reference interval, that's not always possible. And some people, as we know, lots of people have undiagnosed medical issues, like things going on that we don't know. And so the reference intervals are measuring the average of the population, but they are not necessarily, in my opinion, normal, and definitely they are not optimal. We know that 88% of the population is metabolically unhealthy. And so again, that's the population we're using to look at reference intervals. And so some labs aren't set by reference intervals. Some are determined by medical consensus, like by a medical governing body has set the range, but some of these haven't been updated in many years, many decades. And so, they're worth just kind of looking at again. And so blood glucose and lipid recommendations are, examples of those. So when you hear everything in range is good, that assumption is far from really reality or optimum health, in my opinion. So reference ranges are a reflection of the general health of society, and we know that our general health of society is not great. And so just because someone is metabolically unhealthy, and that's again 88% of the population, that does not disqualify them from being in that reference range and getting those numbers. And so I want to train people to look at what are their optimal numbers, not, in a sea of these other people that maybe did not have optimal health. So that's what reference ranges are when you go to look at your labs. Number 2, I wanted to give you a list today of things that affect your lab results, so they don't get skewed one way or another, and then you end up, think that you have to do something when maybe you don't. Okay, first, biotin. So you can look at your multivitamins. Sometimes the amount of multivitamins is not that big a deal, but a lot of people are taking biotin supplements for hair and skin and nails. And so biotin is B7, and that interferes with several blood tests, including sex hormone binding globulin, thyroid, progesterone, and B12 as an example. There's some others too. And so don't take specific biotin supplements, at least for a couple days before you go in. Creatine's another one. I take 5 grams of creatine every day, but if I'm getting labs done, I don't take it a couple days before. That can just artificially elevate your creatine, maybe your GFR results, which isn't necessarily a big deal if we know that you're taking it, then we just take that with a grain of salt. Iron, so I see a lot of people with low iron, and we're not going to go into iron today because that's a whole nother talk. But if you're looking at your ferritin or your total serum iron, the general advice is to discontinue the use of iron supplements 5 days before your test so we can see kind of what your baseline is. I tell people that in general, when you go to get your labs run, don't take anything unless you have some required medication. Don't take anything, that morning of. And again, all labs should be fasted. We'll go into that a little bit too. Some don't need to be, but in general, if you're having a big panel, I tell people to fast 12 to 14 hours because then you can at least hit the ones that are fasted and know that you're good. The other thing I tell people is if you are currently ill, even if you have like a UTI or a cold or something going on, that will affect your labs too. And so that might show like a high white blood cell count or something like that. If you've had an illness and an injury, or if you were on like, let's say prednisone or something like that, maybe you had poison ivy or you had something else going on, this can cause your inflammatory markers to be, sort of, I don't want to say artificially elevated because it's true, but that doesn't give us like a good baseline for where you're at. So if I'm working with you and I ask you for your labs, if you had labs run in the last 6 months and I give you a list and you say, oh yeah, I just had them run last month, I was in the ER. Those aren't the labs that I want to see because obviously you were in the ER for something big deal. Additionally, hard exercise, so not walk or yoga, but like a HIIT workout or something like that, hard exercise close to the day of the test within 24 hours, especially the morning of, can have an effect. So don't do some crazy hard workout and then run to the lab and get your blood drawn, after that. Do it before, if anything. Dehydration is another one. We see that real typically. Again, not necessarily a big deal because we can take that into account. But aside from making the blood draw difficult, like just getting blood, it can be tough if you're dehydrated. Tests are based on blood concentration, which means that if you're dehydrated, the levels can look artificially high just due to blood volume alone. So, You'll want to get up. I even tell people no coffee, really, just, you know, a chunk of water, 12 to 14 hours fasted, and you should be good. Um, so, point number 3, then prepping for your labs. I've kind of covered it a little bit already. Do not eat or drink anything except for water. No coffee either. 12 to 14 hours is the perfect fasting window, in my opinion. Um, the difference, even between 10 and 12 hours, can make a big difference in your glucose. I've had that before, and I've had to rerun mine because my fasting glucose would look high. But then I remember, oh, I ate kind of later at night and then ran in the morning, and it only had been 10 hours. And so that can make a big difference. So 12 to 14 hours. There really is a downside allowing some tests to be done when not fasted. Then you just got to redo them again. Or with my example, it's going to look like my glucose is high, but it's not. And so if you regularly work out in the mornings, skip it the day of the draw unless it's just taking a little walk or yoga. But again, a hard workout or not fasting are the two big things, in my opinion, that can elevate your lab results. So in your handouts, I made a list of annual labs to request, and I'm not going to go through every single one of these because they're all written out here, but I'll give you kind of a list and talk through them a little bit. So A1C, which is related to glucose, we'll talk about. I really like a B12, especially if you have fatigue. B12, a full iron panel, and vitamin D are the 3 things that I look at when somebody comes with fatigue. A CBC with differential, so not just a CBC. That'll break down the white blood cells a little bit more. A CMP, which is just called the metabolic panel, that's where you get the fasting glucose. Vitamin D. Depending on your level of inflammation or family history or what you're looking at or what you're coming into me with, I sometimes like a ESR, which is called a SED rate, or a CRP. Those are both just measures of inflammatory status, like inflammatory markers. They don't necessarily tell us the root cause of the inflammation, but they tell us like your body's in a state of inflammation, and then we can kind of dig more. I like an iron panel. At minimum, a ferritin level is good. But if you are struggling with fatigue, if you are vegan or vegetarian, or even pescatarian, like you don't get a lot of red meat, or if you don't get a lot of eggs, or if you're on a lower protein diet, a full iron panel is a good idea too. And that includes ferritin, total serum iron, TIBC, and an iron saturation. Of course, lipid panel, we'll talk about that a little bit. Magnesium, if you can do it, although blood level measures of magnesium aren't always great, but sometimes people's electrolyte balance is really off, and so getting a magnesium can be a great idea. And without going into full thyroid stuff today, because I talked about that last fall, labs for thyroid, but even just a base level TSH will catch, potentially something that's way off with your thyroid, if you're hypothyroid, or Hashimoto's, or Graves, or something like that. So I made a list then of the tests within the metabolic panel for all of you, and you can kind of read through like each of those and what the breakdown is. And I go through ALT, AST, albumin, BUN, and just kind of what do all those things mean. Calcium, carbon dioxide, chloride, creatine we talked about, glucose again is in that. Which I'm going to dig into glucose and lipid panel a little bit more today. pH, potassium, total protein, and sodium, which is another electrolyte just like magnesium. And so sodium, as an example, like if that's off, you're really not going to feel good. And so an imbalance suggests a need for sodium correction, high or low. Usually I see issues with low. And so if it's chronically off, that can point to an issue with your kidneys, and then maybe you run some more labs, on your kidneys. So let's dig in and just talk a little bit about glucose, because I feel like that's a big one with diabetes and people that are having metabolic issues or wanting to drop weight, but that's a typical, so that is a piece within the CMP or within the metabolic panel that you're going to get done. And so there's 3 like sort of blood sugar measurements that I like. We got fasting glucose. There's A1C. And then probably my favorite, but a lot of times you won't be able to get that run unless one of the other 2 are off, is fasting insulin. And that really tells us kind of your insulin sensitivity. And so A1C only really gives us an estimate for our average blood glucose, and it doesn't really show us the highs and the lows. Um, Sometimes it's nice to be able to see a pattern of glucose, both fasting and then maybe after a meal, because some people maybe overall don't have high blood sugar, but I work with a lot of people who have a problem regulating their blood sugar. And then, of course, then we look at what their diet is and trying to make that blood sugar just kind of more stable throughout the day. Because when your blood sugar's off and up and down, that can really make you feel like crap. Um, and so our body's ability to regulate glucose is essential because if if you have excess glucose, that's really like toxic to your tissues and organs. And then, like I said, that can lead to diabetes and other metabolic health conditions. Um, and so when your blood glucose is too low and you feel like you're crashing, um, there's something that signals glucagon signals the release of more glucose. And so when it's too high, then insulin will signal the storage of glucose, and then that turns down the release of your body store of glycogen, which is the name for stored glucose, and that can really mess you up too. So baseline glucose in the morning, 60 to 90 is sort of generally what's said. I think 60 something is pretty low, but 70 to 95 is good. 90 something, again, that's 12 to 14 hours fasting. um, your average blood glucose then can be higher, meaning that throughout the day, if you were to take the glucose at different times when you're eating or fasting or whatever, that anywhere between 90 and 110 is even fine. So that's the metabolic panel. That's one of them, big one that I talked about that has all those components. And then there's the CBC with differential. And so that will measure your red blood cell count, your hemoglobin, your hematocrit, and a handful of other things, your white blood cells. And you want to get the differential because then that'll break down things like neutrophils and other things in that lab. And so that's really important too. And again, when I work with people, I require a set of certain labs and blood chemistry, and then I dig into those before I meet with you in your first session, and I can see and even just I can see kind of little things going on and patterns, and then I connect that with your clinical symptoms of what's going on, and that tells me a little bit, maybe what we need to do, lifestyle, diet, or maybe some supplements. So let's dig into the lipid panel maybe a little bit. So components of your lipid panel, that's your LDL, your low density lipoprotein. Sometimes we call that the bad cholesterol. I'm not really a fan of that. Your LDLs alone and even your full cholesterol panel are not necessarily indicative of heart disease. So 75, it's one measure, but I don't like to put too much stock in it. 75% of people that come into the hospital with heart attacks, 75% of them have quote unquote normal cholesterol. And so cholesterol is not the only piece that affects heart health. And so I don't want to put too much stock in it, but there's a couple pieces of the lipid panel that I like to look at in particular. LDL is generally not one of them. Then you have your HDLs, we call that your good cholesterol. I like to look at that one. That's your protective factor. That's a lot of times what you would get from an omega-3 supplement or fish, flaxseed. Then you have your total cholesterol, just your total number, 150, 200, 250, whatever. And then your triglycerides, and we call them trigs or tris. There are three fatty acids. That's why the tri name is in there. And so that's the main lipid in the blood, and that tells us how fatty your blood is. And if they're extremely high levels, if they're pretty high, they actually can get the sample, like your blood sample, can look like milky or cloudy if their triglycerides are very high. The primary driver of high triglycerides, which is the number one thing that I look at in the lipid panel, is high triglycerides because that's an inflammatory marker, is consumption of too much energy, meaning you are eating too much. And particularly you're eating too many carbohydrates or processed food. And so carbs, sugars, processed food. High triglycerides are correlated with one of the biggest threats to your health, which is metabolic syndrome overall. And so if you have low triglycerides, under 100 is really good, under 150 even, then you're probably in good shape for the most part, regardless of what the rest of your cholesterol looks like. So to get a good picture of your metabolic health, you'll want to know your triglycerides and your HDL. So those are the two things that I look at. A basic lipid panel in isolation without looking at Any other factors and looking at the rest of your blood work is insufficient to seriously evaluate cardiovascular health. So what I look for is a 1-to-1 ratio between your HDLs and your triglycerides. That could be up to 1 to 3 and still be pretty decent. So example, if your HDLs are 50, which that would be a little on the low side in my opinion, but not awful, then your triglycerides could be anywhere between 50 and 150 and still be pretty decent. My total cholesterol, for example, is 240, which they'll say is high, but my triglycerides and HDLs are at a perfect 1-to-1 ratio. They're 75 each, actually. And so again, we're just looking at ratios and patterns. And if you're not sure, sometimes getting that blood work run every year and just seeing what's happened is a good piece. But those are my thoughts on kind of on the lipid panel. That's one of the panels that I do require people do before they work with me within 6 months to a year. So we're not looking at old labs or whatever, but triglycerides under 150 for sure, under 100 is amazing. And then your HDLs, I like to see 60 plus with the HDLs. That's a little bit harder, marker to move, but then we'll talk about increasing like fish in the diet, flaxseed oil, heart healthy fishes. And then I have most people on some sort of an omega-3 supplement because our consumption of omega-6s in this country is super high, and so it just throws a ratio off. But those are my thoughts on lipid panel. So then there's some other tests, like some of the other ones I talked about in the beginning. Your B12 can test for low energy or some issues with central nervous system. I talked about ESR, which is SED rate. That's an inflammatory marker. Same with CRP. We talked about ferritin and the components of an iron panel. We talked about A1C a little bit too. Fasting insulin. I really like this over the A1C and fasting glucose, or in addition to. But this is probably one of the best tests for metabolic syndrome is fasting insulin. When fasting insulin levels are high, it indicates the body's overproducing insulin, and you do not want that. Vitamin D we've talked about a little bit too. Like I said, I like that 70 to 100, but so when you get the vitamin D range and it says 30 to 100, you just want to be in the upper quadrant of that. So I'm kind of a lot of times looking in the upper third of things or the lower third of things, depending on kind of what the test is. And so just a couple numbers to throw out. Again, everybody's body's different. Blood pressure, we talk about 120 over 80 in general. Your fasting blood glucose, ideally under 100 is great. Your A1C under 5.7, triglycerides under 150. HDL is at least 50. I think 60 is even better, but at least 50. One of the other things we don't talk about that isn't really lab related is just your waist measurement. So around your waist, we don't really want a waist measurement over 35 for women or over 40 for men, because that is just, again, one of the markers along with all these other things that contribute to poor metabolic health. So the last section I wanted to talk about today before we take questions, and I'll cut the video before we do questions, is just other symptoms that I see when I'm working with people overall, and then sometimes a couple labs, either over and above or specific labs that I might suggest based on clinical symptoms. So I always talk to people on the phone first before I see them. So fatigue, I told you, was number one. So that's feeling exhausted, can't wake up, constantly wanting a nap, feeling overwhelmed, underfueled. Some people aren't eating enough. A lot of times people are just not eating enough food or sometimes not enough protein. Anxiety, like emotional fluctuations, mood changes, unexplained weight loss or gain, either loss or gain that's kind of really fast, like over the course of a year, you put on or you take off a whole bunch that you can't figure out because nothing else has changed. Brain fog and some confusion. I see that a lot of times within that perimenopause time. Headaches, I see that pretty often too. Could be frequent low-level headaches or could be chronic migraines. Hair loss, overall body aches and pains due to unknown causes. It's not like you fell down and you're all bruised up and so that's why things hurt. Frequent infections, like frequent UTIs, or you're always getting a cold, or you pick up the stomach bug pretty easily, or food poisoning or things like that. And sleep disturbances are probably the last thing. Just people come in and they're not able to sleep. So for fatigue and that foggy head feeling, unexplained weight loss or gain, disturbed sleep, hair loss, headaches, abdominal pain, mood changes, body aches, all that. I really like a full thyroid panel. So that includes TSH, T3, T4, and then you're going to want like an antibodies test. Sometimes they call that TPO antibodies test. But any of those symptoms, I would get a full thyroid panel, not just a TSH. Fatigue and unexplained weight loss or gain, a metabolic panel is a good idea for that. Body aches, pain, foggy thinking, brain fog, fatigue, and weight gain, I would do a full iron panel, that 4-point iron panel we talked about. Body aches, pain, inflammation, weight gain, a CRP or an ESR, so the SED rate or the C-reactive protein. Those are both good because those measure kind of inflammation. And I know inflammation is like, we say like inflammation, like, what does that mean? It can mean lots of different things, but you're just, like you're always getting sick, or like I said, you put on all this weight, or you feel puffy is a lot of times what people say. Fatigue, you can notice fatigues in all of these. Fatigue, unexplained weight change, body aches, and pain. I think magnesium is a good check for that because we're going to look at your electrolytes. Fatigue, weight change, body aches and pains, and repeated infections, definitely a vitamin D. If your vitamin D is upward towards 70 to 100, that is a protective factor against infections. COVID, flu, kind of all that stuff. So those are the general pieces of labs that I would look at. And so I know some of you brought your labs today. We can kind of look at those. And so just looking through kind of some of those numbers, or maybe what happens is that you look at your own labs differently, or maybe this gets you to run labs and you haven't. Maybe you haven't been to the doctor, which is great if you haven't had to, but maybe you haven't had labs run. Maybe you're just not feeling great. And so maybe this just gets you to like do some basic blood work. And so I think that's good too, just to kind of check things out and see where your baseline is. It's a good thing to do once a year and just see where things are, because then as your body changes or things change, or hormones change, if you don't feel good, then we want to compare like what your normal was before, so we can see what's changed. Glucose could be example of that, or anything else. So I'll stop now. We'll run through questions and then we'll go from there.